Good morning, everyone. How's everyone? People online, can you hear this? I just want to verify. Can I get some kind of indication whether online is with
Yes,
us?
we can hear you.
Okay, perfect. Thank you. Well, just very happy to be with you all today, especially during this holiday week. So thank you for those of you who are able to join. I've had let me pull this back a little bit. I've had the privilege of being able to work with, over the past few months, our colleagues at IU Lab. And for those of you who don't know, the university writ large is taking really serious this idea of translation and impact. And one dimension of that is the university having a much stronger presenting part or way in which industry can interact more effectively with the campus and with Regenstrief. And so we're really lucky to have David Rosenberg join us, and he leads the IU Lab. And he has a really interesting background in that he previously worked in the state. He worked as the Secretary of Commerce for the state of Indiana, has a large background in industry and of the bureaucracy of industry. And I think that makes him very well positioned to offer leadership for the IU Lab. And so he's been kind enough to come introduce the Institute, if you don't already know about IU Lab, what its intentions are, and maybe we can start to have a dialogue in the Q&A session on how Regenstrief might be able to be a better partner to IU Lab and to the campus. So without further ado, David Rosenberg.
Thank you. Thank you all for coming out. I know you are not here for us, but for the free food, but we appreciate you listening to us as we move forward. David Rosenberg, President and CEO of the IU Lab. With me is Matt Jaworowski. So if you hear Jaws or see Jaws in an email, that's the long Polish last name for Matt that he's shortened to Jaws. And so really appreciate you guys having us today. Want this to be very much conversational and iterative, so feel free to throw your hands up if there's questions online. I don't know how we'll see those, but feel free to. Okay, Beth's got it. So please put your questions in the chat. We'll make sure they get answered. But again, want this to be very iterative, conversational, to make sure that we can leave here thinking about opportunities to collaborate and grow our partnership. So since we're amongst friends and family, you know, I think the reason that IU Lab was really launched is that President Whitten really saw the need based on IU's history from a great research institution and going to get that research, doing the research, going to get additional grants. But there wasn't a lot of that translational or commercialization from the research that IU was doing. With a nearly $1.2 billion research enterprise, our rankings for transfer, commercialization, IP licensing were lagging behind those at other universities. And so President Whitten has really come in and directed the leadership team to take an aggressive approach. This goes from everything from how faculty is looked at for tenure track and what they're essentially graded on, to our Faculty 100 initiative and the hires that we're trying to make, to really pushing the researchers and faculty to do more of that transfer, commercialization, working with industry partnerships. We can do both. You can walk and chew bubble gum. We can still be a great research institution, and that is absolutely the intention to continue. But we want to see more of that research now moving into the commercialization aspect and impacting the lives of people everywhere. And so the IU Lab is really the signature initiative to drive that innovation and translate that academic research into that real world impact. We will be anchored just across the bridge over at 16 Tech. If you've driven by, our construction is going vertical. Should start seeing floor slabs for floor 2 going in next week. The tower crane's active. 16 Tech was really a strategic decision. There were a lot of, should we be on campus? Should we be off campus? Where should we be located? 16 Tech was really that strategic decision to show the external world that this is not just another university initiative. This is truly looking at what does industry want to see and where do they need to be over the next 10 to 20 years? And how can a leading university like IU help support industry in achieving their goals? How can we bring more startups? So it was a very intentional decision to not be located on campus because it's not just another academic program or academic building. Again, we were launched to really close that gap between IU's $1 billion research enterprise and the commercialization outcomes that we were seeing or weren't seeing in this case. Continue to amplify the state's role as a $102 billion life science economy. It's obviously one of the main drivers for the state of Indiana, and IU should, and I think will be a true leader in this space, not only for the state, but for the entire country. And then maximize our industry partnerships and diversify the revenue streams. This was really a great foresight by President Witten and the leadership. This was well underway before January 2025, with a lot of the uncertainty and questions around federal funding came. These wheels were already in motion, plans were already being made, so that when that uncertainty came about, IU already had a plan and could execute and really look at how do we diversify and not just continue to be reliant on NIH or NSF or any of the programs from DC. So we were really kicked off with a $138 million grant from the Lilly Endowment. This is solely for the design and construction of the facility, so we're not getting programmatic dollars for that. The programmatic dollars really come from IU's match, and then also as we look at industry partnerships or other collaborations to fund our operations. We have a $34 million grant from IU Research for shared equipment and the 6 research cores that we'll talk about in a minute. And then we have $9.5 million committed from IU Health, which is helping to fund our IU Health incubator at IU Lab, which we'll touch on, and then also a future studio space that's to be determined. This is kind of a look at how we're looking at our building and the programming within our building. The building will be open August of 2027. We are not waiting for that facility to launch this programming, and I've already had a couple of very successful programs that we've been able to launch in our first year, which will then continue to grow and be located in the building. But it very much tracks around the KPIs within the Lilly Endowment grant and what we need to achieve when that building's open. So 6 research cores I mentioned, again, state-of-the-art equipment that's funded by IU Research will be accessible for faculty, for startups, for industry partners to use in the research cores and in collaboration. These were really designed working internally with IU, but also with our external and industry partners to determine where we as an ecosystem really see ourselves over the next several decades and where we need to make those investments now. So these microelectronic sensors and imaging, the AI, ML, and data science core, basic biology enablement, advanced and sustainable chemistry, which is really a response to the Lilly Endowment and CICP's charge for Catalyze Indiana, our translational biomarker, which is in partnership with School of Medicine and IBRI, and then Analytics IN, the genomic sequencing core, which again is with Analytics IN through CICP, the Lilly Endowment, and the consortium members. So all of the sequencing for the genome will be done by Yunlong Li in our building. So we'll have up to 8 sequencers as they try to build the database to get to the 250,000 sequenced genomic sets that they're looking for. Then the 3 main kind of programmatic areas we're looking at is academic gateway, focused on that multidisciplinary approach. Luddy's new biomedical engineering and informatics masters will really be the anchor in our academic gateway, and that program will launch this fall. And then we're also working with Kelly on a business of biotech that'll be located in the lab. But again, we want to figure out how do we take a School of Medicine, Luddy, Kelly, School of Science, put them all together in the building for that true multidisciplinary approach that industry is really championing and pushing, and we've seen at other leading peer institutions that are leading in the space. The second programmatic areas are entrepreneurship and innovation. So as I mentioned, we have our IU Health Incubator, which has both a pre-accelerator and an accelerator program. We'll have 30 to 40 early stage human health companies coming through the IU lab every single year from all over the world, both internal and affiliated with IU, but also non-IU affiliated, with the goal of partnering with our faculty and researchers, industry partners, creating that stickiness to keep more of those startups here in Central Indiana and continue to add to the ecosystem that we have. And then the last is the industry partnerships. IU launched kind of an innovative way to look at these with an all services agreement. Historically, as I said, IU's been very decentralized when it comes to these industry partnerships. It was hard for industry to know where to engage, how to bring a multidisciplinary approach to it, researchers from multiple schools. So the all services agreement is really a first of its kind, where it's between the IU Board of Trustees and the CEO of the company. And any engagement between IU and that company goes through this all services agreement. The agreement sets out the bureaucratic, legal, pathways for licensing and IP in the overall agreement. So then when researchers have a project that they want to do with the company, or the company issues a challenge that says we need help with this, there's basically a 2-page statement of work that you just have to attach to the overall agreement that sets the framework for that project. So it meets the needs that industry wants to see in terms of the multidisciplinary collaboration, but also the speed to get projects started and not have to do an agreement with School of Medicine, with Kelly, with Luddy, but really the nimbleness to move forward. And again, IU is a leader in the biomedical space already, obviously the largest school of medicine, but nearly $800 million in investments over the last 3 years. A huge number to really stake our claim, not only for the state, the region, but the entire country in leading this effort. Also believe that IU is one of the few institutions that can really pitch and deliver on that end-to-end ecosystem to translate the research into that real-world impact. We obviously have the incredible expertise and researchers throughout IU. We have the investments that have been made in infrastructure and equipment, the proven applications, and then the statewide distribution network with all the partners in the ecosystem, both groups like Regenstrief, IBRI, IU Health, but also the industry partners that we work with, the Cooks, the Lillys, the Zimmer Biomeds, and others. A great example of this is our Lilly partnership, $40 million agreement, largest single agreement in IU's history for industry partnership. But that really shows the scale of everything that we're doing, from research, clinical care, workforce development, but then also partnering with IU Health on delivering clinical trials. And we found out last week that IU Health enrolled the first patient in a new oncology study for Lilly in the entire world. They said it's the first time that's happened in Indiana in decades. And so, again, really trying to figure out where industry wants to be, meeting them where they're at, bringing the right experts, but moving with speed to make sure that we can deliver on what's needed. You're all very familiar with that, so we won't go deep, but there are a few places in the country that can deliver the breadth and depth of experience that Central Indiana as a whole can. When you talk from largest medical school to ecosystem partners to world-leading industry partners, the emerging radiopharma ecosystem that's growing out by the airport, the medtech capital of the world, and I think what's held us back a little bit is the connectivity of all those pieces, and also the messaging and really telling our story. We're very humble Hoosiers. We don't like to puff out our chest and tell all the incredible things we're doing. But I think the right group is at the table with the announcement this week from BioCrossroads on their new messaging campaign on how to tie all these assets together. I think we've all seen more collaboration now than we have previously from the groups that have been involved. So I think we have all the assets. We're doing incredible work. I think we can even take it that next step farther by the continued partnership, meetings like these, the convening power of the state and groups like BioCrossroads. I'm really hopeful and that we'll see even more development, more startups, more capital coming into the region over the next decade. So we talked through this a little bit, but the Eli Lilly partnership, again, the IU's largest single industry research agreement in the history at $40 million, focused on clinical trials and better engaging and moving with speed to enroll patients, and also access to clinical care for Alzheimer's and neurodegenerative diseases, along with workforce programs, both for IU going to Lilly and Lilly coming to IU. For things like certification in clinical trials, Alzheimer's care throughout the state, and identifying Alzheimer's patients earlier to get them into care. So this is hopefully just the start of what we're trying to build with Lilly. Been very proud of how we've taken that multidisciplinary approach from School of Medicine, from Kelly, from science, bringing the right experts to make sure we're delivering on the agreement that we signed back in December. Cook Medical was really our first all services agreement that we signed last September. Again, it's that IU Board of Trustees to Pete Yonkman of Cook. The signature is there. this has been really the leading example of what that all services agreement should be. We currently have 7 different statements of work that have already been signed or close to being signed with Cook, and that ranges from School of Medicine, Luddy, Kelly, athletics, our IT infrastructure. So it truly is that all enterprise-wide IU effort to meet the needs of Cook. One example there, and I don't know why I look so large in that picture on the bottom right, but is the Center of Excellence for Interventional MRI. Cook has made this really what they want to be a leader on in the world, and they're really touting that message. IU is the first center of excellence for them in this space in interventional MRI. That was only achievable because we were able to bring that multidisciplinary approach with School of Medicine and radiology, the experts that they have there, but also with the Luddy School of Engineering, designing the new AI tools that would be required to be able to do interventional procedures through the radiology department. So that is really the shining light example that we want to take throughout the university and with all of our industry partners as we move forward there. And then in April, we signed a 3-year agreement with Zimmer Biomet, really focused on musculoskeletal health, arthritis, and infection prevention. This is really tied to the work that's been happening around the NSF Engines Musculoskeletal Impact Award. So IU as the fiduciary, but the entire consortium of over 100 partners is a finalist, one of 10 finalists for the NSF Engines, which could be a $160 million grant that would come through IU, and IU would be the fiduciary agent for. But obviously, if we land that grant, the Zimmer Bio partnership can expand exponentially with the work that they're already doing in musculoskeletal health and AI and longevity. So we're really excited by this, getting this signed in April, really getting started with their team on what avenues we can take and what projects are there already, but then also how do we add to it once we win that grant. And then our IU Health Incubator, appreciate Regenstrief meeting with our newest cohort of companies last week. It was a great conversation, and the company's got a lot out of that. It's all immediate value on how to partner and how to use the assets that Regenstrief has brought to the table. This really goes back to, we're working intentionally to build the culture within IU for that entrepreneurship, the commercialization that hasn't historically existed. And to do that, we want to provide kind of the scaffolding and the pathways for researchers, for graduate students, for students to be able to take a step out and say, I want to start a company. How do I do that? We offer these programs to help try to create those pathways and build that scaffolding. There's a lot more that needs to happen, and the right people are working on that. And it's been like I said, a charge from the top with President Whitten. But this is one path for them, especially in the human health space. So we have 2 companies that we're working with, and IU Health is sponsoring this for the first 3 years. But Generator is running our pre-accelerator. These are the very early stage companies. They may not even be companies, but they have an idea. They want to know how to file, how to set up a company, how to do a pitch deck, what their logo should be. I mean, all the very basic things of what you need to run a company. And so they run 2 cohorts per year, so 10 total companies each year coming in. We've been very intentional. We want to keep this as local as possible, again, to create those pathways. And I think, this early stage is really where IU is at. So all 10 have been from the state of Indiana. 7 of the 10 have been IU affiliated. And so we want to continue to see that number grow and offer this pathway and this scaffolding for those IU affiliated companies. On our Life Tech Accelerator, it's powered by a group called Plug and Play, which is one of the most active VC companies in the world. But also partnering with CICP and BioCrossroads. They are sourcing companies from all over the world. We've had companies from Ireland and Thailand and all over the country coming through Central Indiana as part of our Life Tech Accelerator. The goal here is to really bring in those companies who are doing great work. They already have customers. They probably have the pre-seed round. They're really looking for that next Series A, Series B, or the overall industry network that they can engage with. They have 2 cohorts per year, 12 to 15 companies per year. And so the second cohort is just getting launched and will run through late June. In the first cohort, one of the companies was acquired by AstraZeneca, which we had nothing to do with, but we will claim credit for all day long. And we also had a founder that was from University of Michigan on Forbes 30 Under 30 for innovation and life science. And again, what we're trying to do is keep these companies here. And so she was looking, where she wanted to locate, and we made a good run at her. She ended up in Colorado, but I think we are starting to really be able to tell our story more broadly, where we can recruit and retain a lot more of those companies. They can come for the programming, but they see the ecosystem, they see the value, and we're able to convert those to companies that want to locate here long term. Here's some renderings of what our building will look like at 16 Tech. Again, opening in August of 2027. Very intentionally designed to be a collaborative space. There are not a lot of offices in this building. We don't want someone, badging in the back door and going to sit in office for 8 hours. This is really designed to have, those students, the programs I mentioned, faculty and researchers, startups, industry partners, all in one place. That can help engage with workforce development, create the next innovation, commercialize the next product. As I mentioned, it is an IU building, but it's more industry focused, and so we welcome Purdue, we welcome Notre Dame, we welcome others. They will just have to work under this 30-foot trident that we have in the front window, but everyone is welcome, and we haven't put like 2025 national champion or anything on there yet, but we may be looking at that. So very excited to get this building. We think it's going to be a place where folks can engage. It's a 5-story building, 150,000 square foot. First 3 floors are very open and accessible, again, because we want to foster that collaboration. With floors 4 and 5, there's more deeper research and some security concerns, so those will be more kind of badge access. But again, we want this to be a place where people want to come and really engage with the ecosystem partners. I think we got a quick tour inside if we can. Nope. I don't know if we'll get this to work or not. But we're happy to send it around, but it's just a fly through of the building and some of the different spaces that we have. As I mentioned, this is the academic gateway. So this is on the first floor. We'll have 3 distinct classrooms. One classroom can hold up to 120 students, but is also very flexible to hold different events. It'll be for IU students, but also be able to house, credentialing for existing professionals. And then Lillian Dowman and 16 Tech are also very invested in the K through 12 space. So how can we get more K through 12 students into the building, not only to let them learn about IU Lab or IU, but to really open the aperture on what they see as a potential career path and understand everything that's happening within the biotech space. And then we have, as I mentioned, a lot of collaboration space. Nearly 60% of the building is collaboration space or lab space, either wet lab or computational lab. And so again, really trying to foster that environment of collaboration and interaction. And then in February, the IU Board of Trustees approved a new entity that is called IU Inc. This is a separate 501c3 entity that will sit outside of the university. It's a supporting organization of IU, and its sole mission is to support the mission of IU. But I mean, it's not a new concept. You've heard of Purdue Research Foundation or Arizona State Enterprise Partners or others that university have launched. But it'll really allow us to purpose build an entity to meet the current market demands that we're seeing, both from industry in terms of how do we move faster, how do we engage in creative structures like joint ventures or equity positions with startups, and even at the federal government, which are now looking for more of those consortium models, for industry and academia come together to pitch for a grant. This can really be that backbone and provide that structure and that governance to go after more of those type of grants. It creates a clear point of entry. Historically with IU, you didn't know where to go, or if you got to someone, it may not be the right school, or there wasn't a lot of that collaboration. Again, connects the partners directly to our $1 billion research, allows us to move with speed and try to remove some of that bureaucracy that universities are notorious for. And as I mentioned, different structures and able to engage in different ways that IU has never been able to do before. And as President Whitten has said many times in our interviews, it's a new day for IU as we look at entrepreneurship and industry engagement. And IU Inc. can really be that tool, that vehicle to unlock a lot of that. And so as we've continued to talk with Rachel and the entire team here at Regenstrief, I think there's a lot of different ways, with Paul, with Sean, with many others that we can continue to grow our relationship and deepen our relationship. The startup, presentation last week, I think was a huge step forward in how we want to bring those startups to Regenstrief and figure out, how we can, engage together and use the incredible asset and expertise that you guys have. So with that, we'll stop there. I'm happy to answer any questions, but really appreciate the opportunity of you guys coming out, listening to our story and what we're trying to build, and really look forward to continued collaboration and finding ways we can work together. So thank you very much.
This is so interesting to see the progress and this vision evolving. And I see a lot of what's there, but I also am kind of seeing kind of what's not there. And so I'm a School of Medicine, well-funded investigator, and I founded a company in 2018 trying to solve real-world problems in the industry, but it's the nursing home industry, and we have insurance company contracts. So when I see the industry, I'm thinking insurance companies, I'm thinking healthcare providers, the nursing homes. But when I look at your main areas, I don't fit. Like our company doesn't fit. We have software we've developed, but it's services supported by software. And so in some ways, like I feel like I'm like a candidate for a lot of this, or would have been, right? Especially as I was in the development stages. And I did do IBRI's like CEO development program some years ago. But now, I don't know that our company and the type of work we do around models of care and trying to impact quality of care and safety in that setting fits.
Great question. And yeah, we have those written into the endowment in terms of our areas of focus. And so we can't be everything to everybody with the lab.
Yeah.
But I do think there will be new opportunities that are able to be captured by IU Inc. So the IU lab is human health focused, and in those areas that were approved by the endowment, IU Inc. is going to be the catch-all for IU in terms of as we look at startups, as we look at industry partnerships. And so, it could be microelectronics, or it could be animal health, or it could be different things that don't fit into, the lab or the KPIs we're trying to achieve with the Lilly Endowment. But we have this new tool that's being developed now that could open up different opportunities that weren't previously available.
Okay. Yeah. Because just as I see health services research, real world evidence applications, and like going that path, I feel like there's kind of some missing pieces, and that's fine if it's not for me and for our work, that's fine. But I just wanted to raise it as I think, gosh, it could have been it could have been really helpful to have that kind of resources and support as we were starting on that journey.
Absolutely. No, thanks for the question.
I have a question from the opposite end of the experience spectrum. So, as a more junior faculty member, we're traditionally in our training taught to think about getting federal funding, and now things have changed and we're kind of expanding where we're looking at funding for careers. Do you have kind of opportunities or trainings designed for folks? Maybe we're not ready to open a company or to start a company. We're thinking about getting more engaged in industry and looking for ways in kind of more shallow or early ways to do that. Love to hear about that.
Go ahead, Matt. He mouthed something to me, so I thought he had a profound answer.
I think that's a great thought and something that really fits well into the overall intent of the Academic Gateway. So Academic Gateway, well, the foundation of it is the Luddy School's BMEI, Biomedical Engineering and Informatics Department. They'll be chaired there and housed there. We're really trying to take a multidisciplinary approach. But within that, it's not just traditional academics, it's also credentialing, non-credit bearing opportunities and ways that we can be developing the next generation of life science leaders. So to that point, I think that those are types of education opportunities that are professional development focused, industry focused, and that can be really a good through line of how we connect the university and our different partners spread throughout, particularly Regenstrief, with the industry partners that we are developing this relationship with, and then help tie it all together. So would love to discuss further and see how maybe that could be something that we can develop. IU Lab did just take on a new assistant vice provost and chief learning officer. They'll sit underneath Jay Gladden and the IU Indianapolis campus, and they're going to be really focused on helping develop the systems to help to integrate education within the building itself. But these are types of conversations we need to be having in areas that we'll be starting to explore further.
And to be frank, I mean, it is new for IU. And so it is not a fully developed, here's the curriculum. There's going to be a new, director for ICO. There's going to be a new dean for the School of Medicine. And so I think it's going to be continue to be evolving. I think, the main thing I can recommend is as you see opportunities as you want to engage industry, as there's opportunities for us all to collaborate, like we have those open lines of communication, because it is, like I said, we've been here 15 months now. And it is a radically different way of thinking for the university. So there's going to still have to be a lot of those internal controls that are built out.
Very cool. Thanks, both of you.
Thank you.
David over here. Can you all hear me okay? Yeah. I just wanted to maybe unpack some of the things so I've been trying to immerse myself in the relationship with IU Lab now for a few months. And so I just maybe should share some reflections and maybe comment on something that Kathleen said. So you mentioned, David, upfront this issue of cultural change at the university level, and I want to unpack that a little bit because I think there are different ways of looking at this. So I think Kathleen is a great example, and I see it quite often, where there's an innovator that is trying to take an idea and translate it into something that's sustainable and moves into a product. IU Lab has a number of initiatives that they're kicking off that are trying to support an investigator-driven innovation, which I think is what Kathleen is getting at. So the first thing I just want to flag is that independent of the specific example that Kathleen gave, I'd like you to maybe comment a little bit on some of the ways that you're trying to incubate ideas being translated into businesses, which I think is what was underneath what Kathleen was saying. I don't think that's a cultural change. I think that's the normal way that the university works. I think the cultural change, though, is a different idea, but you've also talked about it, which is that industry, especially large organizations, don't quite understand how to engage with this nebulous collection of autonomous people. And oftentimes individual investigators are building rapport with Lilly and all of these different organizations, and that is creating friction from the corporate side. And so the other thing that I see that you all are doing is that you're trying to speak on behalf of the university to that organization to understand what their requirements are, what their priorities are, and you're trying to create a playground on which investigators or faculty or staff within the campus, if there's a way that they could offer service or support the industry-driven goals, you're trying to create a framework to allow that to happen. And so I'm seeing the main problem with that as one of education. So like, for example, in the Lilly partnership, there's a goal to create the world's best trial recruitment state in the country, right? That's the overarching goal of Lilly. And of course, there are a lot of different people interested in the notion of trial recruitment here on campus, but it's not necessarily clear that the university faculty are accustomed to thinking about engaging the industry in that way. And so that's the cultural change that I think you're talking about. But I don't think that is independent of what Kathleen needs, which is an investigator-driven, we want to take this idea and turn it into something to become the next Lilly, versus we want to be a partner to Lilly and be in support of that. So
I think the cultural shift is now aligning the incentives. Like I said, for faculty and tenure, and for so long it's been research, publication, traditional things within IU. Whereas the new faculty guidelines, the new hiring initiatives are much more aligned with that commercialization, taking the idea, transferring it. So I don't want it to seem like I was saying that wasn't happening. Obviously, we've had the Richard DeMarquis and others take the idea and run with the football all the way down the field. But we also hear daily from people who say, I have this idea, I don't know what to do, because we haven't built the pathways and scaffolding within the university to support them. And so I think aligning those incentives is now really where the focus is. And it's also being more fair to the founder and the entrepreneur. That's been a big push from President Whitten that she's talked a lot about, where the university would sometimes try to take more than their fair share, which was, again, a disincentive for that entrepreneur to push that forward. And so trying to align all those incentives to get more of that commercialization and that entrepreneurship culture is really the point I was trying to make there.
Yeah. Great. Well, thank you for this talk and providing an overview of some of the substantial initiatives you have underway. So I'm David Hagstrom. I direct the Center for Health Services Research. So kind of taking a big picture view and the ecosystem you're seeking to create in community. I'm just thinking, you are in a unique role to speak to some of the institutions that you're trying to assemble. And so I just wanted to kind of highlight some of the challenges and or opportunities in some of those key partners. So, for example, with IU Health, and seeking to get more engagement with the clinical research or clinical trial enterprise. I mean, you have a large workforce of physicians, some with amazing deep expertise who've, have been trained throughout the country. I think within the healthcare system, there is a lot of, if you enter into any provider clinic and are trying to do something new, the surface level response will be, we're too busy. We have more work to do than we currently can do. So, I mean, in your position, maybe talking, posing with IU Health, how are you going to make it possible for your providers and physicians to engage constructively? Because, asking them to do more is not necessarily stretchy. So that's one point. And then just while I'm sharing these ideas from the university standpoint, where clinical trials, research and recruitment, the bureaucracy around that is the IRB, of course. And so that's, both protects but slows things. And, I'm not here to criticize the IRB. I think they've actually have pretty good turnaround times here. But, that does create a regulatory environment that to operate professionally and appropriately, one needs to be duly respectful for. But are there efficiencies? Or in talking to IU School of Medicine, it seems your investigators are having these challenges with the IRB, and that could apply to data use agreements and those types of studies, not only clinical trials. So just some thoughts about how you can, challenge or create opportunities with some of these key partners to lower barriers.
Yeah, that's you're speaking to what my life has been since September when we really kicked off the Lilly agreement and then signed in December. The clinical trials can only be successful if IU Health is at the table and supported, and they've been a great partner. So we've renegotiated contracts on the clinical trial and services agreement, working very closely with Lilly, trying to build out a state-of-the-art model for not only Lilly but future industry partnerships. And so how do we, to your first point, how do we get that infrastructure in place? Because an IU Health doctor has to see a new patient every 7 minutes. They don't have time to say, oh, they could be a good candidate for clinical trials, or they could look at it. So how do we use some of the rapid activation? How do we put in AI within the health records? How do we have a clinical staff team where their sole job is to look at the patients coming in and market for the doctor to say, hey, you may want to ask more questions about this for the clinical trial. So all those processes and infrastructure is being built out. We've seen really strong results in terms of speed, in terms of startup and getting IRBs and agreements signed and things like that. We're kind of where the rubber meets the road, and now we got to transfer that into actual patients and enrollees. But it's been a good start, but it has been a new process. It hasn't always been smooth with all the partners, but IU Health has really stepped up, working very closely with Brian Schneider from IU School of Medicine, who's the Associate Dean of Clinical Trials for School of Medicine. And I think we're at the beginning of building something that will not only, be responsive to what Lilly wants to see in the state, but also other industry partners that can do more clinical trials with IU and IU Health now.
We have a quick question from the online community from Dayu Sun. Thanks for the information. Could I know if IU Lab may provide computational resources such as GPUs?
Yes, so we will have computational lab space within our building connected to our AI ML data science core, along with some of our microelectronics and sensors. And so we are working with some of the large tech companies. We hosted NVIDIA co-founder Chris Malachowski last week for a full day of meetings with ecosystem partners and state and university leadership. So the computational piece will absolutely be critical to that. I think at GTC, Jensen Wong said there's been 1 million times more demand in the last 2 years for computational power. And so that's going to be critical. And life sciences, biotech is one of those industries that is ripe for, advancing using that computational power and truncating the timeline for things that experts have been working on for many years. Thank you all. Appreciate the partnership.